why the health bill, why other the genetic modified bill, why the bill on violence against women. So you will understand the entire picture. When you understand the entire picture, then we go to the details of how this is being implemented. Now, first and foremost, you have to understand that what we are dealing with is an economic warfare. How is that about? What is happening is this. The Western economies, the leading G8 Western economies, or G7 more appropriately, have seen that they are falling back in economic prosperity compared to eastern side of Asia and the Asian titans. In electronics, they are practically out. So what did they do? They now said, okay, they got the whole billionaires together, and the chairman of all the billionaires in the world is Bill Gates. They got them together and said, what then do we do? Those ones said, well, let us use the embryonic stem cell industry. Let us move into the human industry. So when we go up to this technology, we will monopolize it, and by our own assessment and the business assessment, this business itself is worth 30 trillion US dollars from the projections made so far. 30 trillion, that is 1/3 of world economy. But there is a problem. The way the embryonic stem cell industry, or the embryonic stem cell research works, let me explain this, and you can explain it in a very simple term to an ordinary person. You take an egg from a woman. When you take that egg, you take the nucleus, that's the DNA, from an organ, a specific organ. Let's say you want to make a kidney. You take, somebody comes, he has a bad kidney, and now when you take it, you now transfer it into the egg of a woman. When once you do that, you now embed it in a tissue culture. That tissue can make for that person who is sick. That is what is called therapeutic cloning. So you clone that organ that you want to make. Now, so the idea is you will have a type of medical practice whereby you will not be giving drugs for this. If your kidney is bad or is sick, you just give them a new kidney. But easier said than done. Number one problem, whose egg will you use? Because in making Dolly the sheep, it was made this way. You know the first cloned sheep, the Dolly the sheep. In making Dolly the sheep, it was done this way. This Dolly the sheep, they had to use 295 eggs, destroy them before they were able to make the first steps work. So, for a human being, you will need thousands and thousands, if not millions of eggs to perfect one step. Which group of women will allow you to take their egg for that? It is categorically banned in the United States. The egg donation you are seeing are just simpler egg donation from one person to another. And now is that the Indians noticed something, that their whole villages were ravaged. Many people were dying. People were being kidnapped on the streets and taken, their organs taken. Not just the poor, but anybody who their tissue matched. It might be the Chief Justice of Nigeria that the tissue they are looking for, the American has come to pay $500,000 to a hospital. And the tissue they found, the person they found the tissue match is the Chief Justice of Nigeria. Let's say in this case, let's say Chief Justice of Nigeria. What would they do? They will not kidnap the Keke na Pepe man. They will look for the organ, for the heart of the Chief Justice of Nigeria, because his or her tissue is what matches the person who has paid them. It is not a question of, oh no, they're poor. No, it is a question of who their tissue matches. So what they decided to do was to design a law that will enable them to accomplish this.